Before I invite Dr. Donald Glee up on stage, I would just like to say a few things about Donald. As Sandy has already remarked, we're not printing out bios for this. It's part of our aim to be environmentally friendly, and also because we got bios quite late. Too late for printing. So you can find the bios on Facebook. But a little bit about Donald. I reached out to Donald about a year ago. Donald didn't know me from Adam, quite literally. I emailed him, he took me out for a lovely Italian lunch, and we spoke. And since then he has been a real beacon of hope to me as we progress HospitalAdvisor. He's guided me, he's counseled me, and he's been a very wise counsel. Like I said, I don't come from this industry of healthcare, and I don't know the ins and outs, but Donald has been a tremendous teacher to me. I also want to thank the team at the Hong Kong Academy of Medicine. They've been our launch partner, they're doing this pro bono, and I thank Jessie and her team here today. To Donald, may I now invite you up on stage, and thank you again.
Professor Sophie Chan, Professor Ashish Jha, Shalini Makhtani, distinguished guests, ladies and gentlemen, very good morning to you all, and a very warm welcome to the headquarters of the Hong Kong Academy of Medicine and this Pao Yu Gong auditorium, where we hold lectures and workshops for continuing medical education and continuous professional development of medical specialists. Today we are here for a different but equally important reason, to officially launch the HospitalAdvisor web platform. As the president of the Hong Kong Academy of Medicine, I was thrilled and delighted to be asked by HospitalAdvisor's founder, Shalini Makhtani, to use these premises for the launch of this new social media initiative, to let the patients who have used our hospitals to give feedback and inform potential future patients. She receives the full support of our council for this innovative and invaluable. 2. The Academy is privileged to be associated with HospitalAdvisor. We share the same aim of ensuring the highest standards of healthcare, applying knowledge, skills, and technology to benefit the patient in the best way, seeking continued improvement for optimal doctor-patient engagement, and maintaining our mission and passion to keep Hong Kong people healthy. The global trend, out of necessity, is to strive for excellence and continuous professional development amongst physicians in this fast-paced world. Doctors need to be up to date with the latest treatment approaches published in research literatures. Throughout their fundamental and specialist training, Academy Fellows are taught to critically appraise the best evidence and practice evidence-based medicine. At the same time, they are trained in the highest level of safety and to manage medical emergency. To stay at the forefront of medicine, we at the Hong Kong Academy of Medicine remind all our fellows, no matter what specialty they belong to, that doctors deal with people and not just diseases. To quote from the Lancet paper on health professionals for a new century, health is about people. Beyond the glittering surface of modern technology, the core space of every health system is occupied by the unique encounter between people who need service and those who are entrusted to deliver them. This trust is earned through a special blend of technical competence and service orientation, steered by ethical commitment and social accountability, which forms the essence of professional work. My own specialty, family medicine, is particularly challenging but rewarding, being at the crossroads of individuals and their families and communities, at the interface between general practice and specialist referral, and at the interface between treatment and long-term prevention. Quality and safety of care go hand in hand. These, together with access to relevant information and optimal and courteous engagement with healthcare providers, form the foundation for service excellence and a positive patient and family experience. Regarding safety, the surgeon and writer, Dr. Atul Gawande, wrote a book titled The Checklist Manifesto, How to Get Things Right. He recommends the use of checklists to avoid surgical errors, drawing the analogy with safe checklists used by airline pilots. Dr. Gawande encourages us in Hong Kong to consider building an Institute of International Surgical Safety. It is too easy, however, to focus on the technical aspects, because the overall quality of treatment has to include personal aspects, such as the perceptions and expectations of the patients. I would like to suggest a fuller analogy between hospitals and airplanes. The quality of the flight depends on the passenger's expectations and comfort level paid for, whether first class, business, or economy. Yet the pilot's expertise is common to all passengers, and there is a courteous announcement that reaches everyone. The flight attendant crew is given special instructions at the takeoff and landing when they perform special procedures. The trained flight attendants refresh the passengers, keep them comfortable, cater to them when the attendant buttons are pressed, hand out the landing and custom cards, and ensure their safety. The same principles of professionalism and client comfort are upheld by staff in the hotel. Hence, the travel or TripAdvisor rating websites do represent a good model for HospitalAdvisor for user comments and scores, for satisfaction about client treatment, and cleanliness and comfort of the premises. These are a useful resource for other clients as well as useful source of feedback for quality assurance for the service providers. Patient advocacy in different venues allows patients to influence healthcare. The British Medical Journal is now inviting patients as additional peer reviewers of manuscripts submitted to that journal. The increasing role of qualitative research in medicine will also allow patient views and voices to be heard through in-depth interviews and focus group discussions. A public record of patient questionnaire is a fast quantitative approach to feel the public pulse and raise service standards accordingly. I applaud Shalini Maktani. We need initiatives like HospitalAdvisor worldwide, both for a reality check to improve services to meet the evolving demands of the public, and to give the public a voice in shaping and helping the community. The development is timely, and I'm glad that later in the morning we will hear and learn from Shalini as well as from Professor Ashish Jha, the Director of Harvard Global Health Institute. Doctors are consistently voted by the public to be amongst the most trusted of professions, and even the most trusted among scientists. The people have spoken, and they're getting more and more tech savvy, but they also expect corporate social responsibility. The trust that they give to the healthcare profession and to hospital deserves a platform to record their experiences and advise future patients so that they can make an informed choice. It is our responsibility to give them that platform, and I wish HospitalAdvisor a successful future for the sake of Hong Kong's health. Thank you very much.